Alrighty. So today we'll be discussing the Filipino diet as it relates to healthcare. This presentation is going to be by Justin Chavez and Mara Rosa. Oh, okay. So a little background on Filipino Americans. They represent the third largest ethnic group in the United States. They only trail Mexican Americans and Chinese Americans. As of 2019, the Filipino American population is estimated to be 4.2 million. Um, Filipino Americans have also had a history of misrepresentation when it comes to differences in disease prevalence. This is thought to be due from studies generalizing their findings of one Asian American subgroup and applying it to all Asian Americans. They are also considered to be highly bicultural. um, Filipino Americans will embrace distinctive native cultures, traditions, and customs with American cultures. This acculturation means that they do not solely practice one culture over the other. Um, this can also be translated into their diet. This biculturalism is exhibited as Filipino Americans do not have or have a preference to both traditional Filipino foods and typical Western foods. Um, both of these diets are high in sodium and fats, with the Western diet providing an additional increase in sugar intake. Example of traditional Filipino dishes that are high in sodium are adobo and sisig. Sisig is can also be an example of a dish high in fat, as it's considered to be a fatty meat dish consisting of pig head and liver. We'll go to
Okay, dishes such as these can affect the health of Filipino Americans as it can increase an individual's BMI and waist circumference measurements. This increase can correlate to chronic illnesses. Chronic illnesses that are common in the Filipino Americans are hypertension, high cholesterol, and diabetes. Filipinos are considered to have high binge drinking and smoking rates in contrast to other subgroups of Asian Americans. This can further exacerbate health conditions as a likelihood of the individual developing chronic diseases such as cancer, heart disease, stroke, lung diseases, diabetes, and COPD. Few Filipino Americans believe that medical interventions are necessary when discussing chronic health diseases. Because of this viewpoint, it is important to educate the Filipino Americans on healthy dietary behaviors so as to reduce the likelihood of hospitalizations. If the patient refuses to take medication to help control their chronic illness or illnesses, depending if they have multiple. All right, so we're going to go on to a little NCLEX question here. What three health conditions did the Filipino Americans consider to be relatable to their genetic and dietary behavior that are controllable without medications? And you would select all that apply. You can just pause the screen. Okay, and for your answer, if you chose either diabetes, high blood pressure, or high blood cholesterol, then you were right. And next, we're going to be getting into the nursing diagnosis. So we have a patient who is middle-aged and Filipino post-op, recovering from double bypass surgery with behaviors of hypertension, obesity, and smoking. So we have three nursing diagnoses, and the first one is risk for infection related to post-op recovery, as evidenced by surgical incision site on patient's chest. Nursing diagnosis number two is risk for activity intolerance related to sedentary lifestyle, as evidenced by patients stating, I have an office job, so I'm typically sitting down at work, and I do not do any recreational activities. Then for nursing diagnosis number three, we have deficient knowledge related to lifestyle choices, as evidenced by patients stating, I take my medications so I can, oh my God, I can't see. So I can eat what I want and live how I want.
Okay. So I'll be going over the nursing diagnosis number one, which is risk for infections related to post-operative recovery, as evidenced by surgical incision site on patient's chest. Um, our short-term outcomes are going to be patient will demonstrate an understanding of keeping the surgical site clean and will not demonstrate signs of symptoms or infection while at hospital. Examples of these would be redness, delayed healing, fever, pain, tenderness, warmth, or swelling while at the and the long-term outcome will be patient surgical site will be completely healed with no signs of infection during recovery period. So the interventions for these are going to be educate patient on signs and symptoms of infections. Our rationale for this is by doing so, the patient will be able to effectively communicate their needs or concerns to staff if infection does in fact set in. The second intervention will be staff will provide patient with routine dressing changes. The rationale for this is that it will prevent environmental contaminants from causing infections to the surgical site.
Okay. So for my next nursing diagnosis, the outcomes are short term. Patient will ambulate without assistance for a total of 100 feet before discharge. And my long term outcome is patient will be able to perform moderate intensity aerobic physical activity for at least 150 minutes or more per week by the seventh week of recovery. Interventions for this are promote tolerable light physical exercises indicated. The rationale for this would be physical exercises have an impact on changes in cardiac output and redistribution of blood supply from inactive organs to active organs. Physical exercise provides the patient the ability to inspire longer and is also able to remove more metabolic waste through expiration. During physical activity, muscles need adequate oxygen as fuel so that energy distribution is smooth and stable. So we can monitor and evaluate the patient's response to activities. Rationale for this would be vital signs and O2 saturation levels should be monitored before, during, and immediately after activity to determine whether they're within the desired range.
Okay, so the third nursing diagnosis is going to be deficient knowledge related to lifestyle choices, as evidenced by patient stating, I take my medications so I can eat what I want and live how I want. The short-term outcomes for this are patient will consume a heart healthy diet for each meal while at the hospital and demonstrate an understanding of how lifestyle choices can affect health by repeating information to staff prior to discharge. Long-term outcome will be patient will continue to adhere to treatment and attend follow-up appointments by going at least once per year. Um, our interventions for this would be to define and state the limits of desired blood pressure desired blood pressures, excuse me, explain hypertension and its effects on the heart, blood vessels, kidneys, and brain. The rationale for this is that it provides the basis for understanding elevation of blood pressure and clarifies frequently used medical terminology. Understanding that high blood pressure can exist without symptoms is central to enabling the patient to continue treatment even when feeling well. The second intervention is to assist patient in identifying modifiable risk factors. Examples of these can be obesity, a diet high in sodium, saturated fats, and cholesterol, sedentary lifestyle, smoking, alcohol intake of more than 2 ounces per day regularly, a stressful lifestyle. So the rationale for this is that these factors have been shown to contribute hypertension and cardiovascular and renal disease. So our second question is going to be, what chronic diseases did Filipino Americans perceive to be treatable with medications? Select all that apply. You can pause the video. So if you selected arthritis, myocardial infarction, stroke, and breast cancer, you were correct. And
All right. Well, in conclusion, as it pertains to Filipino Americans, it is best to remember that their culture is not composed of one custom, belief, nor one diet. They are highly bicultural as they share characteristics of both Filipino and Western cultures. As a nurse, the ability to identify these specific characteristics of Filipino Americans, Filipino American patients can help immensely in developing a plan of care. And that is the end of our presentation.
thank you.
Thank you.